Hello, my name is Caleb Lorimor, and today I'm going to be doing a case report on American Psycho's Patrick Bateman. So Patrick is a Wall Street investment banker who also leads a secret life of being a serial killer. He has a very lavish lifestyle, is able to afford whatever he wants and act on compulsions and spend seemingly endless amounts of money on hard drugs and sex. Uh, Patrick lives day to day not being mentally there and sporadically kills his colleagues, the homeless, and even sex workers whenever he chooses. So I diagnosed him with ASPD, or antisocial personality disorder, and basically it's a pattern behavior regarding violating people's liberties. And then some of the symptoms of it is impulsivity, not conforming to social moral norms, severe aggressiveness, reckless behavior towards others, and exhibiting no remorse. So some context is Bateman's able to spend his money however he wants, willy nilly. Um, and that allows for more possibilities to have him get away with as many murders as he wants, being more reckless, not caring for people as long as he tip them off if they need it or want it to get him away. If Patrick were to go to a therapist, I would say there's a possibility of three things they could diagnose him with, and that would be obviously ASPD, obsessive compulsive disorder, OCD, or narcissistic personality disorder. I believe this disorder is diagnosed in some cultures, but not all. It just depends on what cultures observe as far as personalities being normal, good, or bad, and it just depends on their ideals and how they classify different behaviors. And the stigma about personality disorders in general is that disorders should be able to show control over behavior results in symptoms being viewed as rejections of wanting help, and then that can show people as being aggressive or unwilling to change, opposed to being mentally ill. So the evidence of me diagnosing him with ASPD is he shows impulsivity very many times in the film. And then one notable time is at the very end of the movie when he's running away from the cops and he impulsively kills like 8 people on the way, going back to his apartment. Another symptom he shows is the lack of remorse. He shows no remorse multiple times throughout the film, but one of the most notable times is he finds a random homeless man and his dog and kills both of them and doesn't really care about it afterwards. And again, he shows no remorse from that. Honestly, he shows all the symptoms of ASPD, but one of the weakest ones that he doesn't really show as much is consistent irresponsibility. And yes, he isn't irresponsible from time to time, but he's not always irresponsible as far as things like his job and his work. The treatment plan I'd give him is CBT, otherwise known as cognitive behavioral therapy. And then as I read through the empirical article about the different treatments they gave ASPD people, would be contingency management with standard maintenance, CBT, and then driving off intoxicated program. And they basically concluded that all three of them work fairly effectively, but not one more than the other. But it just depends on the person's history and personality. And I believe that CBT is the best plan for him because Bateman never really talks about his problems or ideas to other people, and they don't necessarily can't respond to how he feels about them. So I think it would be beneficial for him to talk to people and have someone try to change his direction behaviorally and then mentally, negative to positive. And then there's not really any ethical concerns with CBT besides the fact that it's argued that it's only really effective for certain parts of people's mental problems and doesn't examine the patient as a whole or a full person. And there's a few situational barriers as far as just having really bad influence from his colleagues at work doing hard drugs and being misogynistic and having bad ideals is just a bad influence for him. And then broad perspectives, this movie portrays ASPD very well in a very exaggerated, extreme way. Obviously, he's a psychopath. Not every ASPD person is going to be a psychopath, not a serial killer. But I feel like people with ASPD can kind of relate to some of the symptoms, just way lesser scale. And then I believe that this kind of shows people that don't know about mental illnesses, kind of like shows the extreme of them, how they think and process different things. And the filmmakers and authors, make these stories to be a good story as well as show how intense some of the mental, their mental is for sure.